So in today's so in today's program, we will be discussing about the emerging significance in psycho-oncology. As we all know that this is a promising and new branch in psychiatry, we will be discussing more on this from the pioneers in the field. Before we start the program formally, I would like you all to join us for a moment of silence. As words cannot express the tremendous grief the medical fraternity is experiencing right now over the tragedy of a trainee from India, as a community and individual, we are stunned. We mourn the tragic loss of life, and our deepest sympathies go out to her families and friends. Om Shanti. So without further delay, this is me, Dr. Rika Rijal, and I will be your host for the program today. I have been working in the field of psycho-oncology since past 2 years, and during my residency in India, my inspiration to work in this field stems from deep commitment to supporting individuals facing one of the most challenging times in their life, that is dealing with the cancer. Witnessing the complex emotional and psychological struggles that the cancer patient and the families go through associated with this diagnosis has fueled me to work in this field. I believe that an effective communication has the transformative power which can help patients find strength, hope, and meaning even in the face of illness. Witnessing cancer and the toll it takes in the individual and the closed one in my own family has further helped me deepen the empathy and understanding of this field. I'm also inspired by the holistic approach to health, recognizing that psychological care is a vital part of the cancer treatment process. The opportunity to make a real positive impact on people's life, helping them cope with the diagnosis, is truly motivating. On this note, I would like to invite the PAN-ECP President, Dr. Prabhat Chialise, for his opening remarks. Over to you, Dr. Prabhat.
Thank you, Dr. Rika. Namaste from my side. Namaste to respected President of PAN, Dr. Ravi, General Secretary, chairpersons of today's event, Dr. Santosh, Dr. Wendy, our international delegate, Dr. Adrian, our speaker, Dr. Rishav, and all participants who have joined us for our third CME. So the topic of today's CME is very interesting, and we have been conducting similar kind of interesting and fruitful and insightful webinars targeting the early career psychiatrist, which will help them in their professional development. And also, we are pleased to say that we also have a senior psychiatrist joining us and giving feedbacks and their own experiences. So this is very fruitful, and we hope to continue such kind of activities much more in future. Thank you very much. Thank you, organizing team, and welcome to all. Thank you. Over to you, Dr. Rika.
Thank you, Dr. Prabhat. Now, moving on to the next section, I would like to call Dr. Professor Ravi Sakya sir for his insights about the program and introducing our chairpersons for the session. Over to you, sir.
Thank you, Rika. A huge congratulations to Early Career Psychiatrist Division of PAN for organizing such a beautiful CMEs. And as far as today's topic goes, I think this is a very, very pertinent and very relevant. Oncology itself is a newer field in developing countries like Nepal. And then the psychological aspects of having chronic illnesses, terminal illnesses, is a very new concept for at least for non-psychiatrists. I'm very fortunate to be working in a hospital where this palliative care and this hospice services is also integrated. My own vice chancellor, he is the pioneer in palliative care medicine, and then we get to see a lot of psychiatric aspects of such chronic illness and even oncology. And then we whenever we are called upon, and when we see our colleagues handling the psychological aspects, we do feel that how much we need to do. So how much less our colleagues know, or even let's say psychiatrists, how less the psychiatrists are doing. So, but I'm very now proud that our youngsters are coming up with all these subspecialties, and they are opting to be specialists in these, and then they are rendering services to our needy people. So, without much wasting the time, I know we have a diverse audiences, and we are very fortunate to have the experts in this field. So, may I? This is my privilege to introduce first Professor Dr. Santosh Kumar Chaturvedi. I have been fortunate to meet him in person in, I think, Virat Nagar, and also Virat Nagar, sir. I think, yeah, in one of the National CME of Psychiatric Association of Nepal. And as you can see from the PowerPoint slide, that Sir has been honorary consultant psychiatrist in Jagat Guru Kripalu Chikitsale, Vrindavan, and he also had been a former dean and professor of psychiatry in Nimans, India. He had been a member and a board of the director of multiple international psycho-oncology societies. He has received multiple awards by Indian Council of Medical Research. He has been awarded Commonwealth Medical Fellowship on Cancer at Manchester, UK, Dr. D.L.N. Murthy Rao Oration Award of Indian Psychiatric Society on Cancer in Mind, and also our own local award, Dr. B.P. Sharma Oration in November last in I think that was in Virat, if I'm not mistaken. And then he has had more than 130 publications on psychosocial oncology and palliative care, more than 650 scientific publication. He has edited and published books on communication skills in palliative care, psycho-oncology, Indian perspective, and he says, I'm sure we will all benefit from his insights. May I have a pleasure of introducing another um, uh, expert in this field. I also have again privilege of personally meeting him in Park Village last year, I guess, on a conference on oncology. There was a session on psycho-oncology, if I'm not mistaken. I think Rishabh also presented in that one, and I have privilege of listening to her also that time. So Dr. Wendy, she is associate professor, the head of the Division of Behavioral Sciences at School of Public Health, the University of Hong Kong. She had been founding president of the Hong Kong Jockey Club Institute of Cancer Care. She was president of International Psycho-Oncology Society, and she had been awarded 2007 Hirumi Kawano Young Investigator Award, the International Psycho-Oncology Society. She also has received Distinguished Merit Award by International Society of Nurse Cancer Care. She has co-edited fourth edition of psycho-oncology textbook, and she had been associate editor for psycho-oncology and for patient education and counseling. So we are very fortunate to have both of you, sir and ma'am. Welcome to this CME, and I wish all the best for the success of this CME. Thank you. Over to Rika.
Thank you, sir. We certainly are very much privileged to be in between the professionals in psycho-oncology, and I would like to welcome you all to this program. And moving on, I would like to call upon our PAN General Secretary, Dr. Manoj Dhungana, sir, to introduce our speaker for the program, Dr. Rishav Koirala. So over to you, sir.
Thank you, Rika. Warm greetings from Nepal to Professor Dr. Santosh, Adrian, and Wendy. It is a very burning issue current days in Nepal, because oncology is now very growing overallly, and psychologically impact is very, very high. Not only diagnosed case, but also people have fear of cancer. That's why they also need psychological support. Today's I want to introduce our speaker, Dr. Rishav Koirala. Dr. Rishav Koirala holds a PhD in psycho-oncology and served as an executive director at the Brain and Neuroscience Center, Nepal, with a decade of clinical and research experiences. Dr. Koirala is a pioneer in the field of psycho-oncology in Nepal. In 2016, he established the first psycho-oncology unit at Nepal Cancer Hospital. And similarly, he extended his service in National Cancer Center and Kathmandu Cancer Center. Uh, Now he is the executive he is in executive committee on the role of treasurer treasurer of PAN for tenure of 2024-26. Thank you.
Thank you, sir. So we'll move on to our formal program. And during this time, if any of the participants have any question, they can leave their query in the chat box, or later in the discussion part, they can raise their hand for the questions. So I would like to invite Dr. Rishav Koirala, sir, for his speak on psycho-oncology.
Sir, kindly mute your mic, please. Yeah. Rika, is it visible?
Yes.
Yeah. Good evening, everyone, and good afternoon to the few. As you all know, mental health is intricately connected to every aspects of our life and influencing not only our overall well-being, but also our physical health. In some physical illnesses, its impact is more profound than in others, and that's particularly true in cancer care. So, a cancer care diagnosis doesn't just affect the body, it immensely affects the mind as well. So, despite this, cancer treatment often focuses heavily on physical aspects of disease, while the psychological toll remains under address. And the mind-body connection in oncology care has become, but it has been become increasingly evident, and yet there remains a critical gap in addressing mental health needs of patients and their families. So today we'll explore the emerging significance. Bharat sir, kindly mute your mic. So today we'll be exploring the emerging significance of psycho-oncology, a field dedicated to bridging the gap between oncology and mental health. We'll discuss how psycho-oncology not only enhances the quality of life for patients, but also improves treatment outcomes. By the end of presentation, I hope you'll see why integrating psychological care in oncology is not just beneficial, but essential too. A few months ago, I was invited as a panelist in a cancer survivors meet where survivors and the family members said their struggles, and their focus was primarily on psychological impact of cancer. Discussion about cancer, chemotherapy side effects or treatment costs were minimal. Instead, they spoke about the overwhelming fear, hopelessness, and emotional challenges that came with the diagnosis. So that really highlights what changes a cancer brings to a person, and not only the person but also the family members. Cancer is still often viewed as a death sentence, and both the specialist and patients tend to focus heavily on psychological aspects of the illness, ignoring the psychological aspects. Uh, However, research and clinical practice not only show that addressing only the physical side is not enough, but for proper treatment and better outcome, psychological aspects needs to be addressed. Over the last quarter of century, a large number of psycho-oncology studies have indicated that 30 to 40% of cancer patients fail to adapt to the illness and present emotional disorders as a consequence of cancer and cancer treatments. And among them, depression, anxiety, adjustment disorder are the most common as per ICD and DSM. But additionally, if we see 15 to 25% of patients experience significant psychological conditions like health anxiety, irritable mood, demoralization, or general emotional distress. And although these symptoms are dysfunctional and maladaptive, they often go unrecognized by standard diagnostic tools like DSM and ICD. Hence, they require other screening methods and careful evaluation for proper identification. These symptoms as a whole is termed as distress in field of psycho-oncology. So distress is regarded as a collection of symptoms which is specially used in psycho-oncology. And there is ample of evidence that clinical significant distress is associated with maladjustment to illness, reduction of quality of life, impairment in social relationship, longer rehabilitation time, poor adherence to treatment, abnormal illness behavior, increased cost of treatment, and possibly shorter survival. Based on this evidence, the National Comprehensive Cancer Network, NCCN, which is one of the largest organizations working for cancer, and nearly all cancer care organizations have recognized distress as the sixth vital sign in cancer evaluation. And now, providing services to address distress is mandatory for any center to be recognized as a cancer center by organizations such as NCCN and other major international bodies. But sadly, in our country, our major national cancer centers do not provide this service. Now, psycho-oncology presents unique psychological challenges distinct from general psychiatry. First is understanding the psychological impact of life-threatening diagnosis, distress. The mental health professionals must also consider the emotional burden of aggressive treatments like chemotherapy and radiation of these patients. Addressing issues related to body image, sexuality, and identity affected by cancer or its treatment is also crucial here. Cancer can be a chronic illness with recurrence and complication like metastasis. A lot of patients did have to go through it. And fear of cancer recurrence, FCR, is a well-studied phenomena and impacts huge percentage of cancer patients. Additionally, the process of coping with terminal illness and end-of-life issue is necessary for many cancer patients. And finally, existential crises are commonly encountered and may need attention to in this kind of patients. So when we review the history of psycho-oncology, for a long duration, cancer was only seen just as a core physical illness, ignoring the profound psychological and social experience. Though the foundation of this field were laid in 1950s and 60s by some pioneering clinician researchers, cancer was still seen as a death sentence all over the world at that time, like it is seen in our part of the world, even now. And in 1969, Kubler-Ross book on death and dying did have some influence in the field of psycho-oncology. It was only in 1970s when the psycho-oncology began to take shape. When in 1977, Dr. Jimmy C. Holland, she started a full-time psychiatric clinic in a cancer hospital, formally, and in New York, that was in 1977, and she is also regarded as a mother of psycho-oncology, therefore. And in 1983, first International Psycho-Oncology Conference was held, and that led to the formation of IPOS, International Psycho-Oncology Society, on 1984. So, talking about the practice of psycho-oncology in Nepal, it has been ongoing since long by mental health professionals in Nepal. Like Ravi sir said earlier, and the provision of mental health support to cancer patients has been going on in an unspecified way. In psychological psychiatric services have been offered in several teaching hospitals, tertiary centers with both, but these centers have both cancer and psychiatry units. But formally, it was only in 2016 when first psycho-oncology clinic was established in Nepal Cancer Hospital and Research Center. And gradually it was expanded to Nepal Cancer Hospital, Kathmandu Cancer Center, and as an advancement in 2024, psycho-oncology nurse specialist training has been started in Nepal Cancer Hospital and Research Center, and there are further plans to start it in Nepal National Cancer Hospital very soon. So in our team of Nepal Cancer Hospital and Research Center, we have Dr. Namdata Pradhan, Dr. Nikesh Raj Bhandari, Regina Katel sister, Bobby Adhikari sister. And in National Cancer Hospital, we have Dr. Rika Rijal, our sister Inu Basnet, and in Kathmandu Cancer Center, we have Dr. Sudan Karmacharya, and all of us are working together. So to talk about research, like in general mental health scenario, like in Nepal, research in psycho-oncology is still in early stages. However, there has been few significant publications, uh, and mainly some of them focused on mental disorders and distress in cancer patients, validation of distress thermometer in Nepali, which has also been done, but that was for the last version, earlier version. Sadly, during the time of publication, a newer version appeared, but that is also translated in Nepali, but that I don't think that has been validated. And screening of suicidal ideation in cancer patient, which is also a very hot topic, and we have found out that there is a screen with the distress thermometer acts as a screening tool. Now, talking about challenges faced in psycho-oncology in Nepal, there's several key points which emerge when you talk about it, and there's low awareness of mental health. Particularly psychosocial impact of cancer. Both healthcare providers and patients often do not recognize the importance of integrating mental health in cancer care. The psychological issues are often viewed as weakness or taboo, both in cancer patients and the general population. And this stigma results in decreased referrals and reduced help-seeking behavior among patients and their families too. And with the limited professionals, limited number of psychiatrists, only a few working, especially in psycho-oncology, unfortunately, and in addition to that, there are no clinical psychologist or counselor dedicated to psycho-oncology units or in cancer hospital, though there are some who see the referred cases who are referred from cancer centers. And there's also lack of specialized training in psycho-oncology for psychiatrists, psychologists, and additionally, there is inadequate healthcare infrastructure, further that compounds to these challenges. And as previously mentioned, more research is needed to generate evidence and fill the existing data gaps. Now, to advance psycho-oncology in Nepal, several key steps need to be taken. One could be incorporating psycho-oncology in the psychiatry and clinical psychology curriculum. It will increase awareness and expertise in this field. Government cancer centers in Nepal currently lack psycho-oncology units, as I mentioned earlier. Establishing these units would greatly benefit cancer patients as well as the field itself. And this would also promote a multidisciplinary approach to cancer care. The development of psycho-oncology cannot be left solely to the private sector. So making collaboration with NGOs and the government is also essential for this group. Now, to address some of the previously discussed needs, it would be beneficial to involve additional experts in this field. Therefore, we're trying to share this information, and even this webinar is for that purpose too. And implementing training and awareness programs for relevant stakeholders is also essential. Teleconsultation can be extended, so can extend services to inaccessible areas. And this method, we have been using this method too, but only for few patients. And finally, collaborating with NGOs focused on cancer survivors could also provide valuable resources for our effort. And it would also promote the presence of psycho-oncology on the service users. Now, finally, what can we do for the interested newcomers? Our team can support newcomers by offering relevant resources and materials. With growing awareness among oncologists and cancer centers, many are now receptive to including psychiatrists and psychologists in their teams. So if anyone is interested in partnering with their regional cancer center, we can also serve as a connecting link. We can guide you in research work and organizing awareness programs, and also connect you with international bodies and experts related to psycho-oncology. So you can contact any of us. Most of us are personally connected, or you can use the email address also. And with this, I thank you for your patiently listening. Rika?
Thank you, Dr. Rishav, for your insightful session on psycho-oncology and giving us an overview of the status of the psycho-oncology in Nepal. I hope that many of us will be inspired to pursue this field in future. Before we open the house for discussion, I would like to request everyone to open up their cameras for a quick photo of the attendants. So kindly everyone open up your camera, please. Also, welcome Tiana. She's the special guest for today's program. So are we ready, Dr. Dipesh?
Yeah, Rika, yeah. I'm taking some clips. I'm requesting everyone to open their camera. We are done. Thank you.
Thank you so much. So I would like to hand over to our chairpersons to open the house for discussion. Like I said, you can keep up your comments in the chat box, or you can raise your hand and we can go up with the discussion. Over to you, Dr. Santosh and Dr. Wendy.
Thank you very much, Rishav, for giving a very succinct overview of the situation. And it's very interesting that I remember when you came to Bangalore for the early career program by Dr. Chaturvedi, you at that time also mentioned your interest in psycho-oncology, and I'm very happy to see that you are persisting with that, and gradually it will happen. I have been associated with the EPOS, the International Psycho-Oncology Society, since 1986. And I spent some time with Dr. Jimmy Holland in 1986 at the Memorial Sloan Kettering, and also did some training in UK with Dr. Peter Maguire, and been doing communication skills. So with these opening remarks, Wendy, you want to say anything before we take any questions?
Sure. Thank you, Dr. Santosh. And also, I concur that, Dr. Rishav's presentation was it was an excellent talk, and he gave a very good presentation overview of the status of psycho-oncology, especially to me, I'm very proud to see how much psycho-oncology has been developed in Nepal. Although, yes, I know it's still very as of infancy state, but I can see the progress that has been achieved and progress so much for the past, in recent years. So I congratulate to everyone's effort to put into the field. And I also want to draw on one of the slides that Dr. Rishav mentioned earlier on. He identified a number of challenges, and I just want to say that these challenges are not just happening in Nepal. If you talk to many of us who work in the field, and you will hear that regardless whether you're in the US, whether you're in Canada, or in other part of the world, we all still face the same challenges. So I think there's a lot of opportunity for us to work together to trying to overcome these challenges to make a better world for patients who are facing with the diagnosis of cancer. Thank you.
Are there any questions in the chat, Rika? Or
So we've just got some compliments about the program in the chat box. Maybe someone would like to raise their hand and ask their question directly. So please feel free to ask any questions.
maybe I can ask Rishabh while others are waiting. Rishabh, what is the situation of the volunteers, the cancer societies? I mean, do you have any, because in India, we have an Indian Cancer Society, which is very active, and it has been there since last 30, 40 years. And for a long time, psycho-oncology was actually done by volunteers, which were the survivors and, family members of cancer patients.
Yes, ma'am. I have also been to some of the groups, the survivors, and there are different groups in Nepal, like different groups, and even the cancer hospital, Nepal Cancer Hospital, National Cancer Hospital, they promote their own groups. So they have been actively involved in raising awareness, providing the psycho-oncology services in a unspecific manners, like supporting them. And as I mentioned earlier, the cancer survivors meet that I had attended, like they also encourage the people, like the patients who have been going through the treatment for cancer, and by sharing their experiences, consoling them and giving them strength. So that has been going on. There are several programs being held every year by this group of people.
Yeah.
Yes. And I think we should capitalize those group
Yes.
of people too. Yeah.
Can I add one thing?
Yeah, sure. Sure, Dr. Shakya.
Yeah, to be very specific, there's a big support group called Cancer Care Nepal. I think Rishabh must be aware. And they do help patients with cancer, even financially, as well as in all sorts of means help. They even volunteer to take them to the hospitals. Yeah, we do have a lot of volunteers, and Cancer Care Nepal is one of the key players. That's all. Thank you, sir.
So we have few questions in the chat box.
Yeah. Can you read them out for Rishabh to answer?
Yeah, I'm also reading it, sir.
Yeah, sure.
It's about psycho-oncology providing targeted counseling and support to address the psychological and emotional needs of caregivers.
Yeah, because the thing about psycho-oncology is it's a bit different than other field. It does not only cater the needs of patients, but it is also targeting the needs of the cancer caregivers, not only family members, but also targeting the needs of oncologists and even nurses who are directly dealing with them, because it is a very intense and mentally taxing job, because you see a lot of deaths, a lot of recurrences, and so that does help, because addressing, like in any other mental health condition, addressing the need of the patient will directly reduce the burden and emotional needs of the caregiver. So that has been very important. And I just want to mention, because Dr. Utkarsh, we had discussed earlier too, and another interesting aspect would be like addressing the needs of parents whose children have cancer. So this is a big field that needs to be very feel untouched, and a lot of people, like parents, I've seen it is very traumatic for them. So this kind of care, this kind of support has really helped the patient. It is quite gratifying too. So I hope I answered your question. Yeah, and there's another
Rishabh, can I
coincidence. Yeah,
add
please.
to this?
Yeah,
Can I
yeah,
add?
please.
It would comes to a specific question. This children having cancer. To my knowledge, I think World Children Cancer Society (WCC) have been supporting Nepalese children having cancer in various aspects, including the psychosocial aspects. Only yesterday, I recruited one psychological scholar, means as a uh, childhood family support officer. So their job is basically to support the psychological aspects of not only the patient but also the family members. So their work will be to counsel them and also to help them come to the treatment center, go back home, and if need be, support the lodging at the treatment nearby to the treatment center. So I think the some works already have been doing, to my knowledge, around 7-8 years. And then it was well established in Kanti Children Hospital. And then, fortunately, just for your kind information, that was established in Patna Hospital also this year. So we also have such provisions. Actually, I wanted a full-fledged clinical psychologist to look after that, but the financial situations were like that. Only we could only recruit the bachelor level psychologist. So we do have, of course, we can work on that, I think. Uh, Thanks for your interest. Sorry for meddling too much.
No,
I
no,
think I
no.
should keep give a
No, sir,
chance.
No, your
it has been
contributions are
very
important.
insightful,
Yeah.
sir. Yep. And it is a coincidence that I just saw that Utkarsh had also um, commented. And yes, ma'am, I do look like we all do look forward to like having collaborative work and even like sharing our experiences as well as our research experience and working together and having a very multicentric studies. We have been discussing before this like meeting too that it would be really nice to have a multicentric research and especially catering to children. We'll be in touch with you to Utkarsh. So shall I go through the comments one after another?
Yeah.
Yep,
Right.
and Prabhat, yeah, so um, for early career pathway, like see, currently what I've seen is like for the timing, every one of us has not been working fully for psycho-oncology clinic because it is difficult to sustain. As Ravi sir earlier mentioned, also having a full-time job in psycho-oncology in Nepal is still difficult. It's challenging, and so what can be done is like connecting. We can connect you with nearby cancer centers because we are in connection with oncologists, and we've been presenting in oncological conferences quite frequently. And what we can do is like we can give you like connection with international organizations, and that way the best thing would be to connect with your nearby centers which provide cancer services and give them a part-time service like we all are doing right now, all the team members. And apart from the nursing staffs, all the psychiatrists, we are like we're doing a part-time service. So I hope that someday the organizations will be able to fully hire a psychiatrist or a full clinical psychologist for that. But till then, I think we should have patience and continue our work. It at least in a small basis. That way we'll raise the awareness, and after seeing our work, hopefully they will start like acknowledging the need more. So, Dr. Namrata, yeah. So, Doctor, you could also share your experiences, Dr. Namrata, over here if you wish. She has also been working in psycho-oncology since several years and in Nepal Cancer Hospital, and currently she is also extending the service in BNB. Um, so it has been quite dramatic in while working in psycho-oncology. Like a lot of changes can like There are cases like in any other mental health issues in liaison psychiatry. There are cases of pain not resolved by any high doses of opiate, people going into respiratory depression, which has been resolved by low dose TCAs. There has been like cases where people having like after months and years of struggle, having depressed and feeling depressed, communicating with us and finally sharing their happiness before they succumb to the cancer. And it is, though it's sad that they succumb to the cancer, but it's so gratifying that at least at the end of the moment we could bring happiness in their life. So and patients compliance, treatment adherence, we have seen people breaking off like treatment adherence just because of depression, of not treating like depression at right time. So there can be a long list. With this, I end my sharing also. But yeah, and last,
I think we are a little short of time
yeah,
right
yeah.
now,
So I
Dr.
think we
Rishabh.
should.
So
Yeah, sorry.
yes, maybe this can be taken up in the email later.
Yeah.
I would like to move on to the next session where we would have some discussion from our chairpersons, Santosh sir and Dr. Wendy. So I would like to start off with Dr. Santosh. Would you like me to share the slides
Yeah,
that you had
please.
sent?
Yeah, please. Please.
Right, sir.
Yeah. Sorry, I mean, it'll probably just complement what Rishav has presented. You have started working since 2016. We have started working since 1986. So there are some common things which are there in the Indian subcontinent, and which I would like to share next, please. So, like for example, the commonest coping mechanisms that we have found, first of all, is denial, and then resort to religion. We know that anything happens, the patient says, I don't know, Allah ki marzi, I leave it to God. And then it's about karma. This is my karma. Next, please. Next, yeah. And this is very surprising. We worked at a cancer hospital next to Nemans, and half the patients who come to a cancer hospital do not know that they have a diagnosis of cancer. And even when we ask them whether they are going for palliative or curative, they are not aware of that. But there was no difference in terms of psychiatric morbidity. They still had equal amount of psychiatric morbidity. Next, please. Also checked about concerns. And this is interesting because this is a concerns scale which I took from Manchester. And the commonest concerns in our patients which need support are obviously like disease, finances, and future. And next slide. Some of the concerns which they did not ask for support is like a relationship with partner, relationship with others, body image issues, sexuality. So these were not even considered important. Next, please. And then, of course, we know that somatization is very common in India in psychiatric practice. It's also very common in Nepal. So when there are psychiatric problems happening in cancer patients, there can also be somatization. And this was the work which I did in Manchester and found that cancer patients who were recovered had somatic symptoms which were not related to cancer. And this is very important because oncologists will treat it like a sign of cancer. Next, please. So this is what I do mainly is teaching effective communication skills, breaking bad news, the important issue of dealing with collusion. Relatives will say, don't tell the patient. Patients will say, don't tell the relative. Many of them come and handling difficult questions. How long will I live? Dealing with anger, dealing with issues like why me? And of course, a whole lot of spirituality issues. Rishabh, I think your country is even more spiritual than India. So spirituality is probably something we should take as a strength for cancer patients. Next, please. And there are some of my publications on breaking bad news. These are available. If you want, I can send copies of these. Next, please. And this is another interesting thing which I found. And unlike the West, where the quality of life is more dependent on functional aspects of the patient, when I did a survey, almost 30 years back, people wanted peace of mind, spiritual satisfaction, and social satisfaction was most important for them. Next, please. And of course, like I said, spirituality and spiritual quality of life. This is one of the hospice in Bangalore, Karmacharya Hospice, where the whole the whole environment is made very, very peaceful, and we deal with care for terminally ill patients. So spirituality is very important. Next, please. And there are numerous spiritual issues which come up at every stage, from breaking bad news, end of life care, during palliative care. Patients have different spiritual issues. Relatives have different spiritual issues. Professionals have different spiritual issues. Next, please. That is when I thought that there is spirituality is in the air. In many of the holy places, like in India, we have Varanasi, Vrindavan, Jagannath Puri. You have spirituality in and around in Kathmandu, in the Pashupatinath, and so many other temple areas which you have. There is spirituality is there in the air. People want to come to such places and finish their last days. Next, please. And then this is the most important, is the spirit. Just the previous one. Spiritual satisfaction is when there is no greed and when there is no desire. And these are the ethical dilemmas in our subcontinent: to tell or not to tell, whether to spend the money on the patient or invest in other family members, who should provide care, morphine availability versus morphine addiction, role of numerous traditional healers, how to provide spiritual care, and issues like euthanasia. So last slide, please. Thank you very much. Can I have the? So there is a YouTube channel where I have a lot of small videos on communication skills related to psycho-oncology. You can see those, and my details are given. You can connect with me. Thank you very much.
Thank you, sir. It's an honor to listen to you, and we certainly would be interested to hear more from you in the future times. Now I would like to invite Dr. Wendy for sharing her some experiences and insights on psycho-oncology. Over to you, Dr. Wendy.
Thank you, Rika, for your kind introduction. So what I would probably begin to talk about about IPOS, because I think International Psycho-Oncology Society is an international platform that will perhaps be able to offer support to many of you in Nepal to go forward how to develop the psycho-oncology service in your country. So as Dr. Rishav mentioned earlier on, that IPOS was established in 1984. So this year, it is our 40th anniversary. So, and in IPOS, we serve as a platform for clinicians, educators, as well as researchers from different disciplines. And the aim is they come together and then they exchange knowledge, insight, and also their experience in the field of psycho-oncology. And our aim is to foster the international communications and participation. So IPOS is the aim is to facilitate, to disseminate our clinical practice, education resources, as well as research findings that contribute to the well-being of cancer patients and their families. And one of our main objectives of IPOS is to enhance the support provided to cancer patients and families throughout the cancer journey, as Dr. Rishi mentioned earlier on. So our aim is to provide support from the moment they diagnosed it until throughout the treatment phase, into the survivorship, and even when they enter to the end of life phase. So we will be there to provide such support. And in order to achieve such objectives, IPOS emphasize the importance of multidisciplinary approach. So we work with a psychiatrist, psychologist, social worker, nurses, palliative care, medicine physicians. So they're all a part of the team in psycho-oncology. So as Dr. Rishav mentioned earlier on, you do need a multidisciplinary team in order to be able to provide to address the demands that we encounter in patients who are facing the challenge with the diagnosis and treatment. And so in IPOS, through conferences, publication, and educational initiative, we actually play a very important role in advancing our understanding of how best to provide psycho-oncology service to our patients. In 2007, IPOS Board of Directors and participants in the National Societies meeting have come up an agreement to create the IPOS Federation of Psycho-Oncology Society. So this is very important for everyone here because the federation members consist of national or regional psycho-oncology societies, and our aims of the IPOS Federation is to globally advocate for psycho-oncology by delivering a consistent message that we emphasize the importance of providing comprehensive psychosocial support care to our cancer patient and family members. So I strongly encourage you to consider to look at our federation and see how we can actually provide support to in Nepal. And also, from an education perspective, IPOS also developed guidelines for psycho-oncology curriculum, aiming to enhance and standardize education and training. So currently we have 13 modules cover various domains, and it has been translated into 10 languages. So you may also consider to look at the curriculum and see if it is something that you may want to do to translate it into your language as well. And apart from that, we also have conferences. As you probably know, we have an annual IPOS World Congress of Psycho-Oncology and Psychosocial Academy that we bring everyone together. And for this year, our 25th annual World Congress will be held in Maastricht, the Netherlands, next month. So I welcome everyone to join us this year. And also, because increasingly we also recognize that traveling to any World Congress can be costly and not everyone can afford it. And so what we are trying to offer now is we actually offer webinar for IPOS members to take part. And also we welcome Federation Society to propose webinar in your own language. And then you can also share your work with the international members as well. So again, this is something that I would like to highlight, and I'm hoping colleagues in Nepal will also consider taking part in the webinars as well. And so we also devote our effort for capacity building in psycho-oncology. For example, we provide training in Africa for capacity building. So this is something maybe perhaps in the future we can also consider to work with Nepal, people in the colleagues in Nepal to do that as well. So to end my comments, I also want to draw your attention that apart from IPOS, there's also another area, ways that you can perhaps join the, especially the regional network. We have an Asian Psycho-Oncology, Asian specific psycho-oncology network. And within that, we also provide support as well. And for the coming PAN meeting, we will be held next year in 2025 in Chennai, in India. And so, and our colleagues in India will be hosting that the APON meeting. So I also strongly encourage you and welcome you to join us as well. Thank you.
Thank you, Dr. Wendy. Thank you for the invitation as well. I think that many of us will be motivated to attend the conference. And if any fellowship opportunities are available for the early career psychiatrist, I'm sure many of us would apply from Nepal as well. So thank you once again. And after meeting you in last year, I was inspired to become the IPOS member. And continuing to the next section, we have special guests from IPOS early career professionals in psycho-oncology, with the first person to speak is Tihana Gaspard. She specializes in oncology and hematology nursing, and she is currently pursuing her PhD at the University of Maribor. And her publications cover various topics and work in psycho-oncology. So I would like to welcome and invite Tihana for her brief discussion on the topic. Over to you, Tihana.
Thank you, Rika, for your kind words. I just wanted to ask about the presentation. Good afternoon, everyone. As Rika said, I'm from Croatia, so currently my time is 4 p.m. So it's a lovely afternoon. And I wanted to talk to you about the opportunities that IPOs have, and as well share my experience as a oncology and hematology nurse. In Croatia, we don't have a specialization in psycho-oncology. The field of psycho-oncology is not clearly defined yet. And what I'm trying to do in my country is basically trying to introduce psycho-oncology firstly to nurses. And that is why I'm doing my PhD, which is going to be creating intervention for the psychosocial needs of oncology patients. Because when it comes to nurses, we are all oriented more towards physical needs of oncology patients. We learn practices, we learn skills, and we become excellent in skills. And then what we are doing is orienting ourselves towards physical needs instead of also as well psychosocial needs. And that is something that I'm trying to change when it comes to Croatia. And what we are going to do is basically we are going to ask patients what they need from us as healthcare professionals and as nurses. And they are going to help us in creating those psychosocial interventions. And then we are going to have sort of education series for nurses where we are going to teach them about all the needs that oncology patient might have during their times of hospitalization, during their time of treatment, and what we as nurses can do to support them in terms of psychosocial needs while managing physical needs. And that is something that is going to take, I would say, around 5 years for the project to be completed. And after that, I think that we are going to have some kind of a first small milestone in psycho-oncology in Croatia, where we're going to have nurses who can be trained, who will be trained to recognize psychosocial needs of oncology patients and then refer them to their psychologists, and hopefully in 5-year time to psycho-oncologists. So I really appreciate listening to the experience from Nepal, because you really showed me that there are a lot of opportunities to learn about psycho-oncology. The next thing that I wanted to talk about, sorry if I'm talking too very speedy, because I have to bear in mind the time. The next thing that I wanted to talk about, as Rika said, is an opportunities inside of IPOS, which is our early career professionals in psycho-oncology committee. We started, I would say, this year. Our chair is Amanda Balakursky from USA. She's from Memorial Sloan Kettering Cancer Center, and myself as her co-chair. What we're trying to do as early cancer professionals in psycho-oncology, we are trying to foster the growth and advancement of the early career professionals in the field of psycho-oncology throughout our worldwide network. And what we're trying to do is to foster alliances and collaboration across national boundaries. We have a lot of things planned out. The first thing that we're trying to do is conduct a series of webinars, and we want to establish a mentorship mentorship program so that early career professional can have somebody who's older, more experienced, to kind of guide them throughout their early phases of their careers. Also, what we want to do as well is to ask for your opinion. We have currently going on a survey that we are sending to all of our young professionals in the fields of psycho-oncology to hear what they want to from us as committee, because we are very big committee, people from all over the world, and we all have different experience, different definitions of psycho-oncology, and different expectations. And if we want to serve as a committee well for all of the members of the ECPP, we want to hear your opinion. And I would kindly ask you, if you're interested in filling out the survey, to send an email either to Amanda or me. You can see our mails on the slide, and to fill out the survey so that we can grow as a committee, and that we can grow as a society in general, and to help and advance the field of psycho-oncology. Thank you.
Thank you, Tihana. Certainly being in IPUS ECPP Executive Committee, it has given us a platform where we can share our common interests in psycho-oncology. And I would even like to share the link for the survey in our chat box, maybe after the meeting, so that the people who are interested, they can fill it up. Thank you once again.
That would be great.
Now, coming to the last section, I would like to invite our special enthusiastic guest from Romania. I'm having a little problem with screen sharing. So, welcome, Adrian. He has done his MS Psychology, and he has extensive education in psycho-oncology. He has expertise on coping with cancer and managing fear of recurrence. He's the host of Beyond the Cancer Diagnosis interview series and the editorial team member of Onco Daily Medical Journal. And he has agreed to speak without the slide. So I would like to invite Adrian for his free speaking. Over to you, Adrian.
Thank you very much, Rika. Thank you very much for inviting me. I will be briefly, and I would like to point out maybe the most important things of psycho-oncology, in my view, which is refer to the fear of recurrence. Sometimes known as a source of cancer return nowadays. What is to be known about fear of recurrence is that fear is one of the first emotions that is experienced by a person. Except for joy, any others emotions are negatives, and the emotional reaction we understand as fear is caused by a sense of danger, whether we are talking about the present or the future. Fear has an history, a culture, and a purpose. Even though we see remarkable advances in oncology nowadays, in terms of technology and treatment management, there is a lack of notable progress on what concerns fear of recurrence on patients, on oncological patients. And consequently, fear of recurrence becomes something very natural and obvious. And of course, it remains one of the unmet needs reported by the cancer of patients. Fear of recurrence, it's a broad concept which has been defined not long ago, in 2017, I guess, by Dr. Sophie Lebel, as the fear, worry, or concern relating to the possibility that cancer will come back or even progress. Nowadays, it is a multidimensional construct with two main objectives. The first is to develop models to provide care, to provide greater access to fear of cancer recurrence within the universities, NGOs, research centers. And the second, to evaluate those effectiveness of fear of cancer recurrence interventions and put it in the practice. Now, it is maybe a common question: why should the medical care team or the oncological medical care team be aware of fear of cancer recurrence? As it was mentioned before, psycho-oncology, it is part or should be part of a multidisciplinary cancer team. Therefore, there are patients that when they are going to receive the diagnosis, if the diagnosis isn't communicated in a proper way, their fear of cancer recurrence is higher, and the patient becomes more stressed, while satisfactory information or results has been associated with the reduction of fear of cancer recurrence. Nevertheless, there is no scientific or medical way to determine who will worry about recurrence and who will not. In this case, it doesn't matter how old are you or which type of cancer did or do you have, even if you are a survivor or not. All that counts is to understand this emotional reaction to oncological disease might appear when you least expect it, as there is not a solution, but there is an opportunity to overcome fear of cancer recurrence by applying coping strategies. And the most effective one, as a patient, is to be flexible. You have to learn to be flexible. Time is changing. As a cancer patient, each day is different. Each day has new challenges. So you have to learn to be flexible and accepting the fact that you have a disease. It's the first sign of a positive coping strategies in terms of fear of cancer recurrence. Thank you very much.
Thank you, Adrian. Like you said, that psycho-oncology is a multidisciplinary approach, and in today's program, we can see that the participants are from different fields, from psychiatrists, psychologists, and nurses. So I'm pretty sure with the enthusiasm that we have now, we can go a long way in the psycho-oncology. Now, I would like to thank everyone for patiently listening to us, and before ending the session, I would like to call upon our secretary of the PAN-ECP for his closing remarks. Over to you, Dr. Dipesh.
Yeah, thank you. Thank you so much, Rika. Namaste, everyone. Now that we have come to the end of today's webinar, and on behalf of our Secretaries Association of Nepal, Early Career Section, I'd like to put forward my brief remarks and vote of thanks. For me, today's webinar was very insightful, and the discussion has enlightened me that there is a need, there's a holistic, we need a holistic approach to address the mental health challenges in the field of oncology. And we can also overcome certain gaps that are existing in this context. And there are numerous opportunities for early career professionals like me, like the clinical opportunities, research opportunities, and networking opportunities nationally and internationally. And I hope everyone enjoyed today's webinar. And I'd also like to notify that we will have certificate distribution, and webinar pictures and video will be uploaded in our page and also in the YouTube page. We also like to take this opportunity to extend our heartfelt gratitude to our esteemed speaker, Dr. Rishav Koirala, for his wonderful presentation. Our distinguished chairpersons, Professor Santosh Kumar Chaturvedi sir and Dr. Wendy for the valuable presence. And it is an honor and privilege for the entire psychiatric community to have you both. Our special guest, Adrian and Tiana, and all the participants for their valuable time. We also like to mention our special thanks to our mother organization, Psychiatrist Association of Nepal, PAN President Dr. Ravi Sakya sir, PAN General Secretary Dr. Manoj Dungana, all our PAN members, and especially our PAN-ECP members, who's and their unwavering efforts for the organization, and especially Dr. Rika for being the architect of today's webinar. And with these continuous love and support, we are growing as a PAN-ECP section, and it has been very motivating and encouraging for us to continue with our work. And we will certainly come up with our fourth webinar very soon. Until then, I would like to say goodbye and see you everyone. Namaste and thank you.
Thank you, Dr. Dipesh. Now I would like to end